Pardon our dust. A new emergency department is in the works. And how about a little love and affection for yourself this Valentine's Day? These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. Sinai-Grace is doing its part to energize Detroit by undergoing a $77 million renovation and expansion of our emergency department, ICUs, and front lobby. We're excited about this incredible investment in the city of Detroit and Sinai-Grace Hospital. In fact, this is one of the largest construction projects in Northwest Detroit in decades, and we want you to get in on the action. On March 23rd, from 10 to 11 a.m., we're having a groundbreaking event. The new president of Sinai-Grace Hospital, Dr. Reginald Eady, the Selected of God Choir, as well as many local leaders will be on hand. Come make history with us. To RSVP, call 313-966-4800. We look forward to seeing you there. Love is in the air this February as we celebrate Valentine's Day and American Heart Month. And it's time to show yourself some love. Cardiovascular disease is the #1 killer in the United States. The Center for Disease Control says 1 in every 3 deaths is because of heart disease or stroke. That comes to 2,200 deaths every day. So what do? Grab an orange. That's right, an orange, or any other citric fruit to add more fiber to your diet. Fiber helps get rid of your bad cholesterol and lower your chances of getting heart disease. Other great high fiber foods are oats, beans, brown rice, and whole grain pasta. Housework is a quick and easy way to burn a few calories as well. Losing even as much as 5% of your body weight can mean better blood pressure, lower your risk of diabetes, and improve your cholesterol. And cut out the salt. A new report says some of our favorite foods add up to excessive salt consumption. Bread, lunch meat, pizza, cheese, soups, and sandwiches. For more great information on your heart, come to our People's Medical College at 10 a.m. on Saturday, February 25th. Our experts will be talking about cardiovascular disease, fact or fiction. The class is free, but seating is limited. Please call 313-966-4800 to register or log on to dmc.org/People's Medical College. How healthy is your heart? Joining us now is Tina Taylor and Dr. Keith Johnstone with some of the top signs of heart disease in women.
Although many people think heart disease is a man's problem, women can and do get heart disease. In fact, heart disease is the #1 killer of women. So I spoke with Sinai-Grace cardiologist, Dr. Johnstone, to learn the risk factors and symptoms of the disease and what you can do to keep it at bay.
The key signs and symptoms of heart disease include chest pain, shortness of breath, sweats, or you can feel your heart fluttering. There are other things similar to that that may not be typical symptoms of one think about with heart disease, such as nausea, vomiting, flu-like symptoms. In the past, women were not taken seriously when they had heart problems. In fact, I've had women who've had heart problems in their 30s. People tend not to think that you have heart disease in your 30s when you're a woman because being premenopausal decreases your chance of having heart disease. But there are women who have heart disease even in their 30s. One thing that women should do to prevent heart disease is, I know this sounds crazy, but to live healthy. Whether it's eating healthy, not smoking, or exercising. All of those things are very important.
Prevention and early detection are key, so make sure to be your own health advocate. Talk to your doctor about your risk factors and what you can do to keep your heart healthy. I'm Tina Taylor for Sinai-Grace Today.
Did you know? Prostate cancer is the second leading cause of cancer deaths among men in the US. But the good news is early detection makes this disease one of the easiest cancers to treat. It's important to know that in its early stages, prostate cancer often has no symptoms. That means the best way to keep healthy is with yearly screenings. When prostate symptoms are present, they may include trouble urinating, blood in the urine or semen, and pelvic discomfort. Yearly screenings are recommended for men over 50. However, if you have a family history or of African American descent, you should begin screening starting at age 40. The screenings only take a few minutes, so don't put off this important exam. It could just save your life. If you or a loved one would like to learn more about prostate health, screening tests, or the latest treatment options, including da Vinci robotic surgery, give us a call. To schedule an appointment with one of Sinai-Grace highly trained urologists, call 313-966-4800. We look forward to hearing from you.
Is it true that people need less sleep as they get older?
Is it true that people need less sleep as they get older? For adults, the answer would be no. We do know a newborn needs 16 to 18 hours of sleep a day. As you get older, you sleep less, and once you're in adolescence, you need about 8 to 9 hours. As you get older into your 60s and 70s, you still spend the same amount of time in bed, but you don't sleep the same amount that you did when you were younger because your sleep is more disrupted. There's more arousals. Older people have more medical problems that prevent them from getting continuous sleep. So they tend to get less sleep at night. But if you account for the amount of napping they do during the day, it turns out they actually get the same amount of sleep that younger adults do. So is it true that you need less sleep as you get older? The answer is no. You still need the same amount of sleep.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.